Hi, Mom. Good girl. Yeah, you're a good girl. Did you tell the mama that you had weighed 81.6 pounds? She's had 2 trazodone 2.5 hours ago. She's a little bit tired. That's why she's laying down. Everything else is good, Mama. Miss you. Looking forward to seeing you later today. Good girl. Good Bella. Yeah. There?
How's it going?
Good. How are you?
Doing well. Do we have someone else in the room?
No, I was just gonna. Do you mind if I tape a couple? Just so my wife can listen to what you're
Yeah. Are
saying?
you okay if I also record for?
No, I do not have a problem with that.
Okay. All right. It's just for my dictation software,
Understood.
so I can save some time in front of the computer. Hi, sweetheart. Well, I'm Dr. Marcus.
Hi, Dr.
Hi.
Marcus. I'm John.
Nice to meet you.
And this is Bella.
Hi, Bella. So I know Bella has a history of not enjoying her time at the vet hospital.
But you know what? I sedated her. I gave her
Yeah.
200 milligrams of trazodone
Wonderful.
about 2.5 hours ago.
Perfect.
Because we wanted to have her nails trimmed as well.
Okay.
And
yeah.
she's a little bit nervous when she's
Okay.
here.
Yeah.
But she's doing okay. She's,
Good.
Well,
I understand she, in general, does better away from her people for exams.
Right.
So I'm just gonna
you
kind of
kick me
acquaint
out,
myself.
right? Okay.
Well, we won't use those words.
No,
I'll
I
take her to the
understand.
treatment
I
area,
understand. Yeah.
and I have some helpers, some trained technicians that'll help me do the exam safely. Check out her possible hot spot, and then trim her
Yeah,
nails.
I don't know if it's a hot spot per
Is it
se.
by
She's
her
been
anus?
working. Yeah, she's been working on it.
Okay.
It's by her
So it
vagina.
could be her
You're
anal
right in
gland.
that.
Oh, vagina. So
Right.
not.
Well, you tell me. My wife has been managing it primarily because
Okay.
she's more comfortable with
Yeah.
her than she is with me.
Okay.
She gets embarrassed. She's kind of shy with me.
Yeah.
But she's a good
She's
girl.
beautiful.
Yeah, she is. She was a rescue though, so we got her way too early. Like she was taken from her mother. Probably,
Oh, okay.
Whatever. I mean, we got her. We're guessing now she was probably 5 or 6 weeks old.
Oh, that is pretty young to be
Yeah.
separated from
So-
mom. Yeah. Okay. Any other changes at home? Any medications she's on currently?
Just the 200 milligrams of trazodone. She's
Okay.
on no medications.
Is she on any parasite preventatives?
She is. She's on the Simparica trio.
Perfect.
So she's got that going on, and we're about ready to re-up on the dose of that. So I was trying to read the fine print up there.
Oh, yeah.
But anyhow.
Do you want me to take that out? I mean, you're
Sure.
welcome to take it out.
Yeah.
Oh, there's a lot of stuff back there.
Yeah,
There
thank you.
you are. Yeah, of course.
That's what I'm reading. Think about this.
She is due for one vaccine. Is she a social doggy? Does she go to boarding facilities, daycare, dog parks,
we
grooming?
don't. No, we don't at all.
Okay.
She's got her little, we have an Aussie Doodle that we got about, it was about a year ago, little more than a year ago. Cosmo. So
Okay.
he's also your patient too.
Yeah, I see Cosmo here. And then I don't see any history of lepto. Did you guys opt out of lepto vaccine?
No, we didn't, but she, like I said, she's not we don't,
You
we're
don't
not
take her
necessarily,
hiking or?
no, we do, but we're not real avid.
Okay, yeah, lepto's
She's got a big
one I
yard that she
do-
runs around in with Cosmo, so, and, I keep her off the beaten, like especially since when we go outside of our yard, we back up to Marquest Creek. And so there's a riparian area, and there's lots of ticks and
wildlife.
everything else, yeah,
Yeah.
so they don't,
Okay. Are you familiar with leptospirosis? You're an MD?
I am.
Yeah,
I'm familiar with it, yes.
okay,
So,
alright, so,
I think she's low risk, but it
Okay.
isn't something that we'd necessarily elect not to do. We just, but anyhow, that's
well, my suggestion would be, based on her lifestyle, we discontinue the influenza vaccine for now. unless if she needs to be boarded or
Right.
she suddenly is like a party animal hanging out with lots of other dogs.
Right.
And then I would recommend the lepto. I consider that one a
Okay.
cord vaccine in these parts.
Okay.
The only catch with doing it, if we do it today, would be she would have to come back at the tech appointment in 3 to 4 weeks for a booster.
I'll tell you what, let's discuss it, let me discuss it with my wife Suzanne.
That's
and
always
see
a
how
good
that-
idea.
You know, that way
Yeah.
we don't commit to a path that we're not.
Okay,
Good.
alright, just
Stick
wanna
to
put
it.
that on your radar. Okay, so then my focus today will be physical exam, check out the lesion under her tail. I'll let you know if it's associated with the vulva or the anus. One thing I'll, really make sure it's not, or is perhaps, is associated with her anal glands.
Right.
And then I'll figure out what treatment's appropriate for that,
Okay.
and we'll do a mani-pedi. Anything
Beautiful.
else you wanna address today?
What we'd like to know is for her at-home treatment
Mm-hmm.
of the lesion, what do you recommend we do? Is there something we can wash her? Because she seems to have a propensity to get, break out at this, I don't
In
wanna
that
call it a
area?
hot, I don't wanna call it a hot spot, but
Okay.
she nervously cleans herself.
Mm-hmm.
Like she's,
Has she
Yeah.
had any other problem areas on her body before?
a couple of times, but nothing, mainly that area.
Okay.
Mainly that area.
Well, it'll depend, what I recommend will depend on what I see,
Okay,
and whether it's just a hot spot, which is what we call moist dermatitis, or if it's truly like a superficial pyoderma.
mm-hmm.
That'll determine if we can go more topical or a combo of topical and systemic, or, I mean, do you have any limitations for her treatments at home that would be extra challenging for you?
No,
or?
not just that she is meticulous in grooming herself.
Mhm.
So if we put on a topical, she's gonna lick it off.
Okay.
It's gone.
How does
So-
she do with the cones of shame?
Her only experience with a cone of shame has been her little, her Cosmo, right, had to have it because.
Oh
Well, we had
no,
to have
so
him.
Cosmo was bumping into her. and-
Yeah, exactly. So, but we kept
Yeah.
him sequestered, so that wasn't that.
Okay.
It wasn't that bad, right? So she didn't have a bad experience. She was just sort of very curious, like, what's that?
Yeah,
You know, like,
yeah.
that's
Well,
weird.
if it's in her best interest to use one,
Yeah,
I'm
no,
not
absolutely.
gonna
We're not gonna have a problem
hesitate
with it.
to recommend it. There's can be a learning curve with it. But I'm sure you're aware, we're living in an antibiotic resistant world, so I
Yes,
don't
we
wanna
are.
overprescribe, and if there's by all means a topical approach to this lesion, and it requires use of a cone, I'm gonna recommend that, okay?
Understood.
Alright. Any
Yeah,
questions?
We're open-minded to all treatments. So
Wonderful.
whatever you recommend, we're not gonna be, resistant to that.
Okay.
She's a good girl.
Yeah,
She's a very
she looks
good girl. She's
very
sweet.
smart.
She is a
She
sweetie.
looks like
She
she's
is
a
very
little
bright.
too smart. She's like,
Yeah,
"Oh,
we
I know
were
what's
boarding her, we took her over to Olivet Kennels
Uh-huh.
over here, and she just didn't work, right? Because one of the things she did was she figured out how to open the gate.
No.
And she fomented an escape amongst all the other
Oh.
dogs, so basically, she was like, follow me, we're out of here. Yeah,
It's like Homeward Bound.
that's
the
right,
movie.
exactly.
All right, would you be able to hand the leash
Sure,
to
absolutely.
me?
Is that
Thank
okay?
you. Yeah, absolutely.
Be
Okay,
good
we'll be
girl.
back in a
Be
few
good girl.
minutes.
Okay,
Come on, sweetheart. Come on.
I'm gonna come with you too, for a little while, okay?
Yeah,
We're gonna go this
walk
way.
us through the door.
There's a big friend.
This way, everybody. Come on. Okay.
Okay. We're back.
The microscope now
Okay.
to see what's going on, and then she'll come back in and let you know what she finds.
Okay, perfect,
Alrighty.
thank you.
You're welcome.
Vulva. It's very angry. It's very raw, very erythemic. There's discharge. There's clumped hair, debris in the hair.
Right,
I looked under the microscope and there are a lot of inflammatory cells and a few paired cocci, a few rods. I'm going to treat topically and systemically.
got it.
And I do want her to wear the cone.
Okay.
Okay. We're gonna start with a 14-day course of cefpodoxime. That's an antibiotic that is really good for skin flora type skin infections.
Okay.
It's once a day. It's just one tablet once a day until gone. We should follow up in about 10 to 14 days before the antibiotics are out, just to make sure that we're right on track with healing. Make sure there's no other complications. Now, sometimes when I see lesions like this, I do want to ask about urinary habits, make sure that there might not be a UTI that could be contributing to the excessive amount of attention in that area. So is she
She
peeing
has
a lot?
had UTIs in the past.
Okay.
So she, has a history of them.
Mm-hmm.
She her current behavior is not indicative of having one now.
Okay.
But there could be one developing, right?
Yeah, so, we could do a urinalysis if we want to today. It is a little bit on the stressful side for dogs.
Yeah, I get it. I get it.
We're going on an antibiotic that typically isn't the first line of defense antibiotic that we use for UTIs, but nonetheless, if you're not noticing any signs, then maybe it's not necessary that we go hunting for whether there's a UTI. Monitor closely though, if any symptoms develop, straining to urinate, frequent urination, accidents in the house, blood in the urine, let me know. And then her anatomy. So she does have a vulva that's recessed. It's really tucked up in there. So it's a moist environment. It can, develop urine scalding. It can develop yeast or other, bacterial skin infections. The more you can help with her hygiene, the better. And sometimes if it becomes a recurrent issue and we're just like done dealing with this, there is a vulvoplasty surgery.
We've talked about that before.
All right.
Yeah. And that's, if she needs to have her little hiney fixed, then she needs to have her hiney fixed. And so
it would be for medical reasons,
Understood.
not aesthetics.
Right. Got it.
Yeah.
Got it.
Yeah, and then to keep her clean, when we're not dealing with infection, she's going home with a topical antibacterial as well as anti-inflammatory cream today. So I would probably avoid wiping too much right now just because it's probably going to be really uncomfortable for her. But for maintenance purposes, try to clean in there at least once a day or, ideally after she goes potty. With either like a hypoallergenic baby wipe or we have even medicated wipes that I'm kind of on the fence about whether I send home now.
Yeah.
I'm inclined to just do the treatment that we're gonna do, and we can add in those wipes if needed. Sometimes the wipes can be a little stingy.
So here's the situation. We have her staying with we're going out of town for 4 or 5 days. This is the first time we finally got a dog sitter that we've socialized. I mean, we've gone through like so many different,
it's hard.
cycles of
I have a dog that's very particular.
So that's and she's the one that's the most demanding, right?
Yeah.
But she's really taken a liking to this dog sitter, likes her a lot.
Do you think the dog sitter she'll allow the dog sitter to get all up in there?
Yeah, I just don't know if I want to ask the dog sitter to be that extensive with, her care.
Well, I mean, she's going on an oral antibiotic. I just worry about her discomfort.
Right.
I could, in theory, put her on oral steroids, but then you're going to be dealing with extra potty breaks needed. Right. In theory, it could slow down.
That's a whole other.
You know about steroids.
I do.
That's your realm of expertise.
That's right. So.
Yeah. So. It's always an option though. If we're having a hard time managing, just let me know.
So we're only gonna be gone 4 days.
Oh, okay.
So we'll be back Tuesday, so it's not.
And you can at least, when do you leave?
Tonight.
Okay, so you can at least get maybe 2 doses of the topical on her today before you leave. Okay.
Have you put one on right now, or are you going to put one on, or is that? I didn't have the medication at hand, and getting her into a position where I could physically access was very challenging. We can, if you'd like us to. I would like to, because I'd like to be able to look over your shoulder and see what's going on, if that's okay.
Yeah, let me get my
Because I want to make sure that I do it correctly.
Okay.
And this is not my area of expertise.
Let's see, and.
Good block going.
Okay. There we go, sweetie.
just kind of. I know you gotta
Okay,
stand
you gotta stand up, honey. Up, up. Okay, good girl. Up. There we go.
And if she lays down at home, that might be a little easier.
Right.
But just kind of like right in this area where it's nice and kind of red.
Mm-hmm.
I'll
Okay.
just kind of rub that in
Okay.
all around.
Okay. I don't know if I captured that on film, but I get the understand. I understand that. Okay.
Just clean this. Yes. Can you get this on?
Here we go.
I don't want you to do any more damage.
Should we take off her collar?
It's fine for that to stay on.
Okay.
I'll just tie this here.
Boy, the cone of shame. Remember when Cosmo had this? That's right. Glad I sedated her.
Yeah. I know, and it's that ouchy. It's just they just don't really want us to mess with it,
Got
and then
it.
it's itchy and just painful.
That's right.
Yeah.
Good girl.
Good job. Oh,
Girl.
yeah, let's fix your ear.